Hello everyone and Eid Mubarak to all my Muslim friends. Today the topic which people told me to take is the spinal anesthesia. So now we will go through the spinal anesthesia, how it's performed, the what drug to give, what are the contraindications and indications in spinal anesthesia. But before going in detail about spinal anesthesia, we should have some thorough knowledge about the anatomical part of the spinal cord, vertebrae, where they are positioned and all. So for that reason, I made some small parts so that it's easy to understand it and it's easy to study the spinal anesthesia topic. So in first part, that is part one, I'll just give the main points on spinal anatomy, spinal cord anatomy, then vertebrae anatomy. So we will not waste any time. We will just directly dive into the part that is the anatomical part of spinal anesthesia. So you can see this picture. This is how the spinal anesthesia can be given. This procedure will be for the patients who for the patient to the patients who is going undergoing some surgeries of lower limb and all. So this procedure is like giving spinal anesthesia in the back region, that is in the back part, that is in the spinal cord. So I think some people have this experience also. They might have undergone some surgeries, no, during that time they had taken, I guess, I don't know who all have taken the spinal anesthesia. Just write your name in the comment section and tell your experience, that how it was and all, if it was good or bad, like what you felt, like what you give me your feedback on this spinal anesthesia procedure, what experience you had, that everything and all, just give write yours. So the spinal anesthesia, it's a neuroaxial technique in which local anesthetic is injected into the subarachnoid space to numb the lower part of the body while the upper part will be in the conscious state. You can see here what they'll do. They'll just inject here. They just inject the drug in the spinal cord, not spinal cord, in the neuroaxial state, that is in the subarachnoid space. So they'll inject drug here, that lower part will be in numb state or in the unconscious state, and the upper part will be in the conscious state. So for to like how we will get to know, like here only we have to give drugs, and here only the spinal here only the CSF is present. How we'll get to know? So to know that, we should have thorough knowledge about the anatomical part of the spinal cord and the vertebrae. So we should have a basic knowledge. At least we should have a basic knowledge of what is spinal cord, like how what sensory innervation is applied, or how it is covered, what are the meninges. We should have a basic knowledge about spinal cord now. So for that reason, this just first part is just for a basic introduction into the spinal anesthesia, that is the anatomical part of the spinal cord and the vertebrae. So now we will move on to the next slide, that is anatomy of spinal cord. As you can see in this picture, this is the brain. As you everyone knows this one. This is the brain. This is the backbone. In the common language, this is the backbone. This is a backbone, and the orange color structure you can see that this one is the spinal cord. This one is spinal cord. This one is spinal cord. These backbones are vertebrae. These are the vertebrae. Total in human body we have total 33 vertebrae. These structures you can see na, protruding structures. These are the vertebrae. We have total 33 vertebrae in the human body. In that we have spinal cord. We have spinal cord. Spinal cord extends from medulla oblongata, from the brainstem till it will end at L1 vertebrae in adults and L3 vertebrae in pediatrics or in infants. You can see it in this picture. If you see this picture, you can see. If you go like in only the lumbar part, you can see na. See, in adults, this orange color structure ends at L1 vertebrae. In adults, the spinal cord ends at L1 vertebrae. But in children or infants, it will end at L3, L2 or L3. L2 or L3. So it extends from medulla oblongata and ends at L1 in adult and L3 in infants. And then what is the length of the spinal cord? This orange color thing called length, what is the length of the spinal cord? It is around 42 to 45 centimeter. It will be 42 to 45 centimeter in length. And these vertebrae, these are the coverings of the spinal cord. Like they are the protectors, now outsider, body like structures. They are vertebrae. These are the vertebrae. These are we can classify them like cervical vertebrae. We have total 8 cervical vertebrae. And thoracic, we have total 12 thoracic vertebrae. We have lumbar 5, sacral 5, and coccygeal 4. So total we have 33 vertebrae. So, spinal cord extends from medulla oblongata to the L1 in adults and L3 in infants. And what is the length of the spinal cord? It is around 42 to 45 centimeter. And it is covered by the vertebrae. It is covered by the vertebrae. These vertebrae are total 33. We have total 33 vertebrae from cervical to the coccygeal. Cervical we have 8 cervical, 12 thoracic, 5 lumbar, and 5 sacral. Coccygeal are 4 in number. This is the spinal cord structure. You can see here it ends in adults it ends at L1 and in children it will end at L2 or L3. Next, you can see this picture. These are the vertebrae. These count. You can see like plate-like structure. These are the vertebrae. These are the vertebrae. How many vertebrae are there? Total we have 33 vertebrae. In that, this yellow color thing you can spot here. This is the spinal cord. This structure is the spinal cord. Where it is ending? It is ending at L1 vertebrae. Means it's an adult spinal cord. Here it is ending. The structure where the spinal cord ends, the structure where the spinal cord ends, like if you think it as in L1 area, L1 vertebrae, this structure is called as conus medullaris. Conus medullaris. Conus, pronounce it. Conus medullaris. The spinal cord where it ends is the structure we call it as conus medullaris. And from this area, from conus medullaris, we have nerve roots arising. You can see these structures now. These are the nerve roots. They're arising in a bunchy manner. They're arising in a bunchy, like in a bulky structures. These are called as quada equina. Quada equina. See, like what is the you can see this picture. This horse is there now. Think this as a caudic, this one medulla, conus medullaris. From conus medullaris they're arising. These are called as quada equina, hairy like structures. They are in bulky structures. This is the quada equina. Quada equina. And you can see total we have 8 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, and coccygeal we have 4 in number. Sometimes they may vary also. So in spinal cord, we have cervical, thoracic, lumbar, sacral, and coccygeal. Cervical 8, lumbar 12, thoracic, lumbar 5, sorry, lumbar 5, thoracic 12, sacral 5, and coccygeal 4. And the structure where the spinal cord ends is called as the conus medullaris. Conus medullaris. And from conus medullaris, we have some nerve roots arising in a bulky manner. Those are called as quada equina. Those are like similar to the a horse tail. It's look like a horse tail. So those are quada equina. Next, when we move on, like if we saw this one, these are the vertebrae. So we will take these two lumbar vertebrae, L1 and L2. These we will remove these vertebrae and we will keep it on a plate. We will keep it on a plate or a surface. So we kept it on a surface. We kept it on a surface. This is how it looks. You can see this one is one lumbar vertebrae. This one is the another lumbar vertebrae. In between two vertebrae, we have a intervertebral disc. We have intervertebral disc, and inside this we have a spinal cord here. You can see this structure. This is the spinal cord. This is the spinal cord, and this is the spinal cord. From here, we can see the nerve roots are arising. So these are two lumbar vertebrae. Again, if we cut this one lumbar vertebrae and we keep it on a surface, this is how it looks. See, this is the one lumbar vertebrae. Huh? So we kept it on a surface. So this is the body of the lumbar vertebrae, and this is the pedicle, and we have the some processes here, and when this is the spinal cord, na, we you can see in the sagittal section. See, this is the spinal cord. In spinal cord, we have gray matter, gray matter and white matter. And the spinal cord is attached to the nerve roots. Two nerve roots, can you see? Can you spot here? These are the two nerve roots. And one is dorsal ventral nerve root and one is ventral nerve root. Dorsal will take the information and it will send it to the brain, and brain will what it will do, it will uh, make a decision, and the decision will come back, that message will come back through the ventral nerve root. And ventral nerve roots, we have this spinal cord, gray matter, white matter present, and we have dorsal and ventral nerve roots. Dorsal will take the sensory information to the brain, and brain will make a decide. It will make a decision, and the decision will come back through the motor, that is the ventral nerve root. This is the one vertebra. This is the one vertebra. This is the spinal cord. Next, we will move on to the coverings of spinal cord. Coverings of spinal cord also called as the meninges of spinal cord. Those are called as the meninges. So, mainly, we have three meninges of spinal cord. Mainly, the spinal cord is covered by three layers. The spinal cord is covered by three layers. They are dura mater, that is the outermost covering, and the arachnoid matter, that is the middle layer, and the pia mater, which is the innermost layer. This is like it is like a tightly bound to the, that is the spinal cord. It's tightly bound to the spinal cord. You can spot in this picture. See, this is the spinal cord. This is the spinal cord. We have gray matter, white matter here, and we have spinal nerve roots like dorsal and ventral. So this structure, this spinal cord is tightly covered by a layer, a meninges or a layer, that is the pia mater. And next, after the pia mater, we have arachnoid matter. Huh? We have arachnoid matter, and outside the arachnoid matter, we have dura mater. Outside the arachnoid, we have dura mater. Total, we have three meninges. In between three meninges, we have some spaces or a gap junction. Those are called as the spaces. Like if the see if the between the space, if the space is between pia mater and arachnoid mater, that space is called as subarachnoid space. That space is called as subarachnoid space. This is the space where CSF is present. CSF means cerebrospinal fluid. This is the space where CSF is present. What is the use of the CSF? It will give the nourishment to the spinal cord. What it will do? Here you can see this is the subarachnoid space. In this area, CSF will be present. What is the importance of that CSF? It will give nourishment to the spinal cord. Next, in between pyometer and arachnoid, we have subarachnoid space. Next, like that only, in between arachnoid and dura mater, what we have? We have subdural space. That you can spot here. That green thing, na, that is the subdural space. And after that, we have dura mater. And outside the dura mater, we have epidural space. Epidural space. Where is the exact location of epidural space? It is between ligamentum flavum and dura mater. It is between flavum and dura mater. So these are the coverings of the spinal cord. What are the coverings of the spinal cord? They are dura mater from outside to inside. We have dura mater, arachnoid matter, and pia mater. In between these meninges, we have some spaces like epidural space, subdural space, and subarachnoid space. But before piercing these meninges, we will go through some structures. Before going like piercing these structures, we'll go through some structure. There, first what we will do, if we inject a drug here, what we will see, we will pierce the skin. Next we will go in the subcutaneous tissue or a fat. After that, what we'll see, supraspinous ligament. There is a, you can see this gray color structure, the line. That is a supraspinous ligament. After that, we have some hairy-like structure. Now that is the interspinous ligament. After interspinous ligamentum, we have ligamentum flavum. Ligamentum flavum. After going the after piercing the ligamentum flavum, we have a dura mater. We have dura mater. This is the covering of spinal cord. We have dura mater. Between ligamentum flavum and dura mater, we have epidural space. Between ligamentum flavum and dura mater, we have the epidural space. This is the space where we will give epidural anesthesia. This is the space where we will give epidural anesthesia. Next, between dura mater and arachnoid mater, we have subdural space. Subdural space. And between arachnoid and pia mater, we have a subarachnoid space. This is the space where we will give the spinal anesthesia. Where we will give spinal anesthesia. And it contains, that's why this spinal anesthesia is also called as subarachnoid block. Also called as subarachnoid block. Because there we have the CSF, the fluidy like structures we have. So this is the coverings of the spinal cord. Repeat it once again. This is the spinal cord is covered by three meninges. They are from outside to inside. We have dura mater, arachnoid mater, and pia mater. So dura mater is the outermost covering, like a guardian. It's like a toughest guardian. It protects the thing that spinal cord is a king of his own kingdom. Think that spinal cord is like a king of his own kingdom. Huh? This king and his kingdom is covered by a protective coverings, protective guardians. They are dura mater, the toughest guardian, and inside we have middle layer, that is arachnoid mater. It's like a web-like structure, like a spider, and inside we have a pia mater, which is closely bound to the this one spinal cord. In between we have some spaces: epidural space, subdural space, and subarachnoid space. And before going through this meninges, we will pierce some structures. There, first we will pierce skin, then subcutaneous tissue, then supraspinous ligament and interspinous ligament, and next ligamentum flavum. After piercing ligamentum flavum, we have a space called as epidural space. It is present between ligamentum flavum and dura mater. So spinal cord is like a king, and his kingdom is covered by three protective layers. Next, we will see the cerebrospinal fluid. As you all know, as in previous slide, I told you, where is the presence of cerebrospinal fluid? It's in the subarachnoid space. The cerebrospinal fluid is present in the subarachnoid space. What is the use of the cerebrospinal fluid? It's like it gives nourishment to the spinal cord. It gives a nourishment to the spinal cord. And this cerebrospinal fluid is also present in the brain also. This cerebrospinal fluid is present in the spinal cord and in the brain, in the brain also. So it has some pressure. It's like we have blood pressure na to flow. If we want, if we the message should carry na, for that, like nutrition should carry to the all the parts of the body. So we have blood pressure. Blood pressure. The pressure should there should be a pressure. Like that in cerebrospinal fluid, we have a pressure that is called a cerebrospinal fluid pressure. So this cerebrospinal fluid is present between, as I already said, it's between arachnoid matter and pia mater. It's present between arachnoid matter and pia mater. Between arachnoid and pia mater, what space we have? We have subarachnoid space. This is the space where cerebrospinal fluid is present. And this cerebrospinal fluid is secreted. It is secreted by choroid plexus of third, fourth, and lateral ventricles. This cerebrospinal fluid is secreted by choroid plexus of third, fourth, and lateral ventricles. And daily, within 24 hours, these ventricles will secrete around 500 ml of cerebrospinal fluid. These ventricles will secrete around 500 ml of cerebrospinal fluid. When it comes to the pressure of the CSF, cerebrospinal fluid, As I said in previous line, like in blood pressure we have to blood the blood should circulate now, so for that we have like a pressure like this only, like that only in cerebral spinal fluid we should have they should it should have some pressure to circulate all the nutrition to the spinal cord and the brain. So for that it has some pressure that is called a cerebrospinal fluid pressure. That pressure when in lying position, CSF will be present in the spinal cord in the brain also. No? So when we are in lying position, when we are in a lying position, what happens? The pressure in the pressure of the CSF is same in cranium, that is in the brain, and in the spinal cord also. It's equal. It's the same when we are in a lying position, that is between 100 to 150 mm of H2O, that is 100 to 150 mm H2O in lying position. But when we are in sitting position, what happens? The CSF pressure in the spinal cord increases. The CSF pressure in the spinal cord increases to like 180 to 240 of 240 mm H2O. Why? Because of the gravitational force. The gravitational force of the cerebrospinal fluid. So this is about the spinal cerebrospinal fluid. It is present between the pia mater and arachnoid mater, where epidural subarachnoid space is present, and it is this cerebrospinal fluid is secreted by choroid plexus of third, fourth, and lateral ventricles. Daily they will secrete total 500 ml of cerebrospinal fluid. When we are in sitting position, in laying position, what happens? The cerebrospinal fluid pressure will be equal in both in the brain and in the spinal cord, in the cranium and in the spinal cord. It will be same. But when we are in sitting position, what happens? The pressure of the CSF will increase in the spinal cord, that is to up to 180 to 240 because of the gravitational force of the cerebrospinal fluid. This is about the cerebrospinal fluid. Next one, you can see these images. These are the two images I kept to show you that why this person always. Some people have experience of the spinal anesthesia. No? So during that time, they will tell that person to sit like this. Why they'll tell? Because these spinal processes you can see, na, these vertebrae are like in an angular structure. They are in an angular structure. So if you sit straight, what will happen? You can see these are the spinous processes. These are the vertebrae. So if you sit straight, what will happen? This also will come here and this will also come here. Like they'll attach to each other. So we can't go inside the in the subarachnoid space to inject the drug. So if the patient bends, then it's easy to palpate this area, these bones, and they'll come outwards. Na? They'll protrude. Those bones will protrude, and we can easily find out the space. Na? And they'll palpate the superior iliac crust. That is like in technique we will see the positions of the in which position we will give spinal anesthesia and all. In that condition we will study that, in that class we will study that. But to show you that why the person who is holding the person who is holding you will tell to sit like this, to sit in a fetal position, because of this only, that those spinal processes or the vertebrae should be visible, like they should be palpable. Then only we can see the space. In between space we will inject the drug, na? We will pierce the skin and we will inject the drug in the subarachnoid space. For that reason they'll tell you to sit like this. Next, when it comes to the arterial blood supply, no need to remember extra thing. Just remember, spinal cord is supplied by two main arteries. They are anterior and posterior spinal artery. They are supplied by just anterior spinal artery and posterior spinal artery. Anterior spinal artery gives part supply to the anterior part of the spinal cord. Think this is the spinal cord, huh? And this is the anterior spinal artery. This is the posterior spinal artery. This anterior spinal artery gives the blood supply to the anterior part of the. It will run down in a runs down. It will runs in downward direction, and it will give blood supply to the anterior part of the spinal cord till like of how much part, which part it will give, till two third part of the spinal cord. Two-third part of the spinal cord is supplied by anterior spinal artery. And in when it comes to posterior spinal artery, it is this blood supply to the posterior part of the spinal cord is by posterior spinal artery. These are they are posterior spinal artery, and it gives one third part of the it supplies blood to the one third part of the spinal cord. And in posterior spinal artery, they usually run down, and they divide into two parts, that is right and left posterior spinal arteries. And they make some small branches of artery, they are called as segmental arteries. And we have radicular artery also. So no need to remember those all things, just remember blood supply of the spinal cord is by anterior spinal artery, posterior spinal artery, these are main arteries. And they'll anterior will give to the anterior part of the spinal artery, spinal cord. And posterior spinal artery will give blood supply to the posterior spinal artery. And we have some small arteries like segmental arteries and radicular arteries also. And like with them only we have some venous drainage. What is the use of the venous drainage? Veins drain them, like they'll remove the waste products from the spinal cord. They'll remove the waste products out of the spinal cord. So they are the venous drainage. These venous drainage will directly drain into the large veins. So where they are present, they are like in mirror images. Like when there is anterior spinal artery, there we have spinal vein also. Like with them only, they'll attach like that only. We have anterior spinal artery, like that we have anterior spinal vein. They are like a mirror images. Those are the spinal veins, anterior spinal veins and posterior spinal veins. That is the venous drainage. So this was just an introduction class about spinal anesthesia, because if we want to know the in detail about spinal anesthesia, we should have a little bit of knowledge about spinal cord, its anatomical part. Then only we can easily understand the spinal anesthesia technique, and spinal in which condition to give spinal anesthesia, in which condition we have to contraindicate, and how much drug to give to that patient according to his conditions and all. And some complications will be there now while giving spinal anesthesia. To know that, to understand better what we have to do, we have to start from basic, that is from anatomical structure. Then we can easily identify the cause. If there is any complication, then we can easily identify the cause of that complication. So for that reason, we should have a thorough knowledge about the anatomical part of the spinal cord and the vertebrae. And this was just a basic introduction about spinal anesthesia. So this is just basic introduction. Now we will wrap up this session. We will see in next class. And before ending this session, I'll just ask you, if anyone have experience of the spinal anesthesia, just write your experience in the comment section. We will see how was your experience and all. And thanks for watching this video. If you have any queries regarding this, please let me know in the comment section. And thank you so much guys for watching this whole video, and keep supporting me. And don't forget to share this video to your friends and tell them to subscribe. I'll try to make good topic videos. So don't forget to subscribe. Thank you so much. Lots of love from Veena. Thank you so much guys.